Welcome back on your Sunday. Thanksgiving, it's best celebrated with family, sitting around the dinner table discussing a wide range of topics, hopefully not arguing. But did you know Thanksgiving Day is also National Family Health History Day? Well, in this country, we know that family health history is an important part of routine medical care. It's so important, in fact, the U.S. Surgeon General has declared Thanksgiving as National Family Health History Day. Today, we want to bring in Susan Aul, who works with the Mayo Clinic in the Department of Palliative Medicine. Welcome, Susan. Thanks for being with us this morning.
It's my pleasure this morning.
So why is it so important to know your family history as a means of personal health care?
According to the CDC, most people, their family members have at least one chronic disease. And as most people know, family genes are passed on from one generation to another, increasing the risk of you developing that disease. It might be heart disease, blood pressure, diabetes, obesity. Mayo Clinic, as many medical facilities, ask questionnaires when you're patients. And the purpose of that is those screenings help your medical provider determine what early detection of known genetic conditions to maybe order some screenings in advance. And that's the importance.
It helps them know what to look for. And so for people who maybe have not had this discussion with their family, guide us through what this looks like. What are maybe 3 questions that we should ask family members that might be useful in helping us? That way we don't get to the clinic and say, I don't know what family history of medical conditions I might have.
Right. As I previously shared with our viewers, some of the chronic conditions, but there's also another one, Alzheimer's, because it not only impacts the person with the disease, but it significantly changes the quality of life for the caregivers. The other thing is you want to know if anyone has a serious life-threatening disease, such as colorectal cancer, breast cancer, or ovarian cancer. What were the ages of the diagnosis, and what were the causes of the death of the relatives who had died? And the other thing is, were there any genetic testing? And if there was, share that.
And these might be difficult conversations to have, understandably. After that happens, say we find something in that discussion with our family members, what advice do you have for folks once they have had those conversations?
Right. And then follow-up questions might be, do they have advanced directives? And that's a witness legal document that explains and states what goals, beliefs, or wishes for future healthcare needs when someone is no longer able to make medical decisions for themselves. At Mayo and in Florida, we use Honoring Choices. It can be downloaded off the internet. Most healthcare facilities have the forms. And there's 2 parts to that advanced directive. The first is a designation of healthcare surrogate. Who do you want to make medical decisions for you when you're no longer able? The second part is a living will. When certain medical conditions have been met and there's no reasonable medical probability of recovery determined by 2 physicians, what are your preferences for prolonging procedures and hospital care at the end of your life? And it should be executed and given to your hospitals and your medical providers.
And like I mentioned earlier, these are obviously incredibly difficult conversations to have there. It's unpleasant to think about. Is that sometimes maybe a barrier for people to have the discussion?
Yes, it's very difficult to have those decisions. And most people say, you know what, I'll do it someday. So it never gets done. And what happens is, just like you said, people are at the hospital and they're asking about history and documents and they don't have them. So let's make the gathering family medical history this Thanksgiving to not only get your history, but to get advanced directives, end-of-life conversations, and they're very difficult. So let's make this Thanksgiving gathering a time to have these important conversations.
Good advice. All right, Susan Aul with the Mayo Clinic's Department of Palliative Medicine. Susan, thank you.
Thank you.